In this present class today we will see about the menopause. 200 years ago, fewer than 30% of women lived long enough to experience the menopause. 100 years ago, the average woman's life expectancy just reached 50 years of age. Now, the average life expectancy is 80 and most of you will be far surpassed that. Ready or not, you can always already expect a better quantity of life. So the question really becomes, how can I maintain the best quality of life? Menopause is the end of menstruation. The word menopause comes from the Greek word mens meaning monthly and poses meaning cessation. Menopause is a part of woman's natural aging process when her ovaries produce lower level of estrogen and progesterone and when she no longer able to become pregnant. By definition, menopause is the permanent cessation of menstruation at the end of reproductive life due to loss of ovarian follicular activity. Phases of menopause. The phase of menopause is usually broken down into 4 categories. The first one is premenopause. The broad definition of premenopause is the time prior to the menopause, the occurrence of menopause before the age of 40 years. Then perimenopause, a period of woman's life characterized by physiological changes associated with the end of reproduction capacity and terminating with the completion of menopause, also called climacteric. Menopausal phase, it is the end of menstruation. The age of menopause ranges between 45 to 55, average age being 50 years. Postmenopausal, it is defined formally as the time after which the woman have experienced 12 consecutive months of amenorrhea without period. Types. Natural menopause diagnosis is established when the menstruation stops for 12 months in absence of an organic or pathological causes. This usually occurs at the age of 45 to 50. The average age is 51. If it occurs before the age of 40 years, it is referred as premature menopause. Induced menopause may be surgical after bilateral oophorectomy, radiological after radiation of ovaries, chemotherapeutic after exposure to chemotherapy during treatment of malignant disease. Pathophysiology. Endocrine changes. The sequence of the endocrine changes as it follows. Decreased inhibin production by the ovary, decreased estradiol blood level, increase in the follicle stimulating hormone production by pituitary gland, increase in luteinizing hormone production. The menstruation may stop abruptly, one more commonly after a period of oligo or hypomenorrhea. During this climacteric period, bleeding from a proliferative endometrium because of anovulation may be irregular acyclic. In such cases, endometrial carcinoma should be excluded before attributing it into hormonal changes. Physiological menopause, the normal decline of ovarian functions due to aging. In most women between 45 to 55, on average of 51, and result in infrequent ovulation, decreased menstrual function, and eventually cessation of menstruation. Pathological menopause, the gradual or abrupt cessation of menstruation before 40 years occur idiopathically in 50% of women in USA. Physiological changes. The lack of estrogen and progesterone causes many changes in the woman's physiology and affect the health and well-being. The symptoms of menopause due to changes in the metabolism of the body. Increased cholesterol level in the blood, hyperlipidemia or an increase in the level of cholesterol and lipids in the blood is common. This led to a gradual rise in the risk of heart disease and stroke after menopause. Osteoporosis, the calcium loss from the bone is increased the first 5 years after onset of menopause, resulting in the loss of bone density. The calcium moves out of the bones, leaving them weak and liable to fracture at the smallest stress. Digestive system, motor activity of the entire digestive tract diminish after menopause. The intestine tend to be sluggish, resulting in constipation. Urinary system, as the estrogen level decreases after menopause, the tissue lining in the urethra and bladder become drier, thinner, and less elastic. This can lead to increased frequency of passing urine as well as increased tendency to develop urinary tract infection. The genital organs, the uterus wall becomes small and fibrotic due to atrophy of the muscle after the menopause. The cervix becomes smaller and appears to be flushed with vagina. In older women, the cervix may be impossible to identify separately from the vagina. The vagina and cervical discharge decreases in amount and later disappear completely. The ovaries become smaller and shriveled in appearance. The ovaries, which produce little androgen during reproductive life, begin to produce it in increasing in amount. The vaginal mucosal membrane become thin and lose its ruggedness after the menopause. Decreased secretion makes the vagina dry. Sexual intercourse becomes painful and difficult due to pain from the dry vagina. Vulvar and external genital organs, the fat in the labia majora and mons pubis decrease and pubic hair becomes spare. The breast in thin-built woman, the breast become flat and shriveled, while heavy-built woman, they become flabby and pendulous. Change the general appearance. Skin loses its elasticity and become thin and fine. This is due to loss of elastin and collagen from the skin. Weight increase, more likely to be result irregular food habit due to mood swing. There is a more deposition of fat around hips, waist and buttocks. Hair become dry and coarse after the menopause. There may be hair loss due to the decreasing level of estrogen. Voice become deeper due to thickening of the vocal cord. Changes in the vasomotor system. Hot flushes are incidents where the woman in the menopause gets sudden feeling of warmth and flushing that start in the face and quickly spread all over the neck and upper body. These hot flushes can occur at any time of the day or night. They vary in number, 1 in every 1 hour, as in 1 in every 15 minutes. The hot flushes are often associated with profuse sweating. Night sweat. Night sweat are closely related with the hot flush. Both usually occur simultaneously. Sweat can occur any time of the day or night. They are more common at night. The sweat can be severe enough to wake up the woman from the sound sleep and make it difficult for her to go back to the sleep. Sudden waking up from the sleep can cause palpitation and sometimes panic attack. Psychological changes are mainly manifested by frequent headache, irritability, fatigue, depression, and insomnia. Although these are often said to be due to changes in the hormonal levels, they are more likely to be related to the loss of sleep due to the night sweat. Diminished interest in sex may be due to emotional upset or may be secondary to painful intercourse due to dry vagina. Social changes during menopause include feeling that a woman holds her about herself and her social relationship, as well as the symptoms she experiences can be defined by culture in which she lives. Women vary in their subjective experience of symptoms. Not all women perceive changes in the body are reflected in the mirror. Some are derived from women's perception of herself based on the account of her expectation vary and are adjusted to the actual experience. Diagnosis of menopause, cessation of menstruation for 6 consecutive months, appearance of menopausal symptoms like night sweat, serum estradiol is less than 20 pg per ml, serum FSH and LH will be more than 40 ml international unit per ml. Treatment, non-hormonal treatment. There may be variety of menopausal treatment, both natural and medical, that will alleviate the symptom of menopause. Dressing in the light layers can alleviate hot flushes and night sweats. Avoiding caffeine, alcohol and spicy foods can also minimize these symptoms. Menopause and weight gain tend to go together due to lifestyle changes than to hormonal changes. Reducing dietary fat intake and regular exercise help to combat weight gain during menopause. Menopause can lead to osteoporosis. Calcium, magnesium and vitamin D can help to restore the bone density, which naturally deteriorate after the age of 30 due to reduced estrogen level. Menopause decreases the vaginal elasticity, leading to vaginal dryness. Vitamin E can help as a Kegel exercise, which help restore the elasticity. Using water-based lubricants during sexual intercourse also minimize discomfort related to vaginal dryness. Menopause often leads to dry, itchy skin and weak, thin hair that breaks and has lot of splinters. Flax seed oil found in poultry, dairy products, red meat and whole grains can help to restore the hair and skin's healthy appearance as it can do by vitamin E. Hormonal replacement therapy. Hormone replacement therapy or HRT is indicated in menopausal women to overcome the short-term and long-term consequences of estrogen deficiency. HRT can be administered orally in the pill form, vaginally as a cream, and transdermally in the patch form because it replaces female hormones produced by ovaries. Hormone replacement therapy minimizes the menopause symptoms. It can be used before, during, and after the menopause. Nutritious diet, balanced diet with calcium and protein, exercise, walking and jogging. Vitamin D along with calcium will reduce osteoporosis and fractures. Indications of ART. First one to relief of menopausal symptoms. Second to prevention of osteoporosis. Third to maintain the quality of life in menopausal years. Special group of women to whom HRT should be prescribed. Premature ovarian failure, digenesis or surgical or radiation menopause. Contraindications of hormone replacement therapy include undiagnosed genital bleeding, estrogen-dependent cancer in the body, history of venous thromboembolism, active liver disease, gallbladder disease. Monitoring the prior and during the HRT, blood pressure, breast examination, pelvic examination, cervical cytology, pelvic ultrasound, mammography. Types of HRT, estrogen and progesterone. Most common type involves both estrogen and progesterone. More than 8 million women are currently taking combination of HRT and it is designed specially for women who have a uterus. During this therapy, estrogen is given regularly with the progesterone is added in on a supplementary basis. These two hormones are given in combination in order to prevent the overgrowth of uterine lining. Estrogen alone may irritate this lining, which could lead to endometrial cancer. Estrogen only. Estrogen only therapy is usually given to a woman who have lost their uterus due to surgical menopause or one underwent hysterectomy. Because if no uterus present, no need for progesterone. Progesterone only means progesterone only therapy is not prescribed very often. Progesterone does not seem to provide excellent relief for the woman plagued with hot flushes. Available preparations. The principle for hormone therapy uses estrogen. This is ideal for a woman who had her uterus removed already. But a woman with intact uterus, only estrogen therapy leads to endometrial hyperplasia and even to endometrial carcinoma. Addition of progesterone for last 12 to 14 days each month can prevent this problem. Commonly used estrogen conjugated estrogen. Progesterone use medoxyprogesterone. Considering the risk, hormonal therapy should be used with the lowest effective dose and for a short period of time. Low dose of oral conjugated estrogen 0.3 mg daily is effective and has got minimal side effects. Oral estrogen regimen conjugated estrogen 0.3 mg or 0.625 mg is given daily for a woman who had hysterectomy. Estrogen cyclic progesterone for a woman with uterus. Estrogen is given continuously for 25 days and progesterone is added for the last 12 to 14 days. Continuous estrogen progesterone therapy, continued combined therapy can prevent endometrial hyperplasia. Subdermal implants are inserted subcutaneously over the anterior abdominal wall using local anesthesia. 17 beta estradiol implants 25 mg, 50 mg or 100 mg are available and can be kept for 6 months. Percutaneous estrogen gel 1 gram applicator or gel delivering 1 mg estradiol daily is to be applied on the skin over the anterior abdominal wall or the thigh. Effective blood level of estradiol can be maintained. Transdermal patch. It contains 0.3 mg of 17B estradiol releasing about 50 microgram of estradiol in 24 hours. It should be applied below the waistline and changed twice a week. Vaginal cream. Conjugated equine vaginal estrogen cream 1.2 mg daily is effective, especially when associated with atrophic vaginitis. Women with symptoms of urogenital atrophy and urinary symptoms do not like to have systemic HRT as suitable for such treatment. Progesterone. Patients with history of breast carcinoma or endometrial carcinoma, progesterone may be used. It may be effective in suppressing hot flushes and prevent osteoporosis. Medoxyprogesterone acetate 2.5 to 5 mg per day can be used. Tibolone Women is a steroid having weakly estrogenic, progesterogenic, and androgenic properties. It prevents osteoporosis, atopic changes of vagina and hot flushes. It increases the libido. A dose of 2.5 mg per day is given. Duration of HRT. Generally, use of HRT for a short period for 3 to 5 years have been devised. Reduction of dosage should be done as soon as possible. Risk of HRT. First one, endometrial cancer when estrogen is giving along with a woman with intact uterus, cause of endometrial proliferation, hyperplasia and carcinoma. Breast cancer, combined estrogen and progesterone replacement therapy increase the risk of breast cancer. Venous thromboembolic disease, it can be found in increase with the use of combined oral estrogen and progesterone. And lipid metabolism, an increased incidence of gallbladder disease observed during the HRT due to the rise in cholesterol. Dementia, Alzheimer's disease are increased. Disadvantage of HRT. Long period non-TB stimulates cell division and this seems to increase risk for breast cancer up to 9%. HRT also appears to increase risk for heart disease by 24%. Women taking HRT to reduce the risk of Alzheimer's disease actually increase the risk by small percentage. In order to prevent increasing the risk of certain disease, it is suggested that we use HRT not more than 5 years. Prevention of osteoporosis. 10 years after the HRT has been stopped, the bone density and fracture risk are similar in women who have used HRT and those who are not. Long-term treatment is required to prevent osteoporosis. Constant reassessment of general health and risk factors is required. Surgical menopause. Surgical menopause is a type of induced menopause in which both ovaries are surgically removed. Surgical menopause can occur at any age before the natural menopause occurs. The symptoms of surgical menopause are generally more intense than the menopause occurs naturally. Induced menopause due to abrupt cut of ovarian hormones causes sudden onset of hot flushes and other menopausal symptoms, the dry vagina and decline in sex drive. Hormonal therapy may be used to treat the symptoms of induced menopause. It stops or reduces the short-term changes of menopause such as hot flushes, disturbed sleep, and vaginal dryness. Counseling and guidance. It is important to understand the individual's needs and priorities when providing counseling. Key points: the decision-making process, problem reported by the woman, decision-making and counseling guidelines and supports. Thank you for listening. If you have any comments, please let me know.